Okay, and we are live. Hi, everybody. How's it going? This is Dr. Ruben Valdez. Incredibly excited to have you all together with me during this live event. I'm very sure that the information that you are about to receive is very actionable, very, very informative. It's going to aid in helping a lot of the decisions on what to do in the next 24, 48 hours, even the next couple of weeks. So thank you so much for joining me. A little bit of background on myself. I'm currently the CCO of Novus Health System, which is a national functional medicine practice system. I'm also director of one of the practices down in Charlotte, North Carolina. I'm a 3 times published speaker on the topic of functional medicine, author, and also international speaker. So, brief disclaimer before we begin. We're learning a lot about this virus, about COVID-19, also known as coronavirus. And every day, as we learn more and more of it, more cases are rolling into the United States. We're going to be able to have more certainty. So every day, the facts are still a little bit fluid. So be aware that maybe something that I say today might change a couple of days from today. But for the most part, we're already getting a pretty solid idea as to what the type of impact and implication that this virus might have actually are. In addition, all of the information is for educational purposes, should not be used to diagnose or treat any disease. Please consult your physician before following anything that I'm presenting here. As we begin, there's really been a lot of hype, a lot of conversation, but none of us have really gotten an inside look as to what is happening within hospitals, within clinics, within centers with this virus. So I want to share just a couple of brief videos. This is in Italy, one of their main hospitals. And as you will see, this is just somebody walking through the hospital. And as they enter the intensive care unit, you're going to see dozens and dozens of patients hooked up onto respirators. So I'm just going to move this a little bit further. Here you go. The quality is not very good, but these are just primarily patients that are hooked up to respirators, and there's just an endless sea of them as you continue to see the video. Is just very interesting. In addition to that, when we look at some of the China videos, you'll see early on in the pandemic in China hospitals, people just kind of flooding the gates, looking for help, doctors frustrated at the system with just their inability to control the mortality rate of the wave of patients that is coming in. Make no mistake, this is a rapidly spreading infection. And I think that there hasn't been a real appreciation of what that is. I'm not here to scare you. I'm not here to worry you. I'm here to make you very alert and very awake as to what is happening and what is about to happen in the next 2 weeks. We had time. We are now at a point where the time is done. There's no more time. The measures that I'm going to talk about here in a few minutes need to be implemented right now, right away, as aggressively as possible to be able to reduce and mitigate risk as much as possible. In addition to that, I want to speak into a very specific population, which is the population that myself and a lot of my doctors care for here in the country. So while we're here, while we're in vigilance, not a single one of you is going to succumb. Pay close attention to what we're going to talk about because it can make all the difference between life and death, especially if you're a type 2 diabetic, which we now know you are probably at the highest risk spectrum for this viral pandemic. So this is a paper that came out of China early when there were roughly about 44,000 cases, and they found that type 2 diabetes was both a risk factor that increases your susceptibility of contracting the infection, as well as having complications and dying from the infection. So they published this paper. It's on its way into diabetes research and clinical practice, and they're talking about how important it is to have a timely, aggressive intervention early into the onset of the spike of the pandemic, which we're going to talk about, because you're going to see that that's now beginning here in the US. And so it becomes pressingly important to understand why action right now becomes critical. This is straight from the CDC. If you are a type 2 diabetic, does not matter if you are controlled. You're going to see that the description of what controlled diabetes is actually flawed. It does not protect you from risk. It does not reduce your risk. And the infections around flu, in this case, flu from coronavirus and eventually pneumonia, are very high in this population. Diabetics are dying at a much higher risk than any other demographic of the population. Diabetics and people with hypertension and high blood pressure are the two most affected. I'm going to give you the statistics. I'm going to show you where I got them from, but from the best available data, we know that the mortality is roughly about 0.9%, 0.85%, 1% for people that have contracted the virus. However, when we look at type 2 diabetics, type 1 diabetics, that rate, that incidence goes all the way up to 7%. Conservatively, some are now even saying 9%. This is an unprecedented time. This is a 1 in a 100-year pandemic. It's already begun to threaten our health, our economy. Scientists and researchers are saying that it will affect 40 to 70% of our population. We will be dealing with new cases showing infection for the next 12 to 18 months. So right now is the time to do everything and anything that we can, because we're about to hit that spike of cases where the propagation of the virus becomes very, very rapid. So those affected with chronic diseases are the most susceptible. We're going to talk about COVID as a virus. I'm going to go through it. There's going to be things here that I promise you do not know about the virus and how it's propagating. We're going to look at the importance of testing, and then we're going to go into the meat of the presentation. There's still a lot of time to change the mortality here in the US. Listen to me. We've been talking about this stuff, especially around type 2 diabetes, for 5 or 6 years now. And for years, it's kind of fallen in deaf ears. And now is the time that everybody is reaching out and really beginning to grasp the urgency and the importance of not diabetic control, but instead of diabetic reversal. So I know that in these live event presentations, a lot of people can't stay through the whole event. And for that reason, I'm going to go ahead and send out a link if you're one of those people that needs to leave, but you're worried about your diabetes, you haven't been tested in a while, you want to be able to take the best possible strategies at normalizing, reversing your blood sugar, knowing that standard treatment might not be enough. If that's you, we want you to visit this link. I just sent that out to all of those of you that are live. Those that at some point get to watch this again, the link will still be present. So go ahead. If you need to leave or know that you won't be able to be with us for the full 30 minutes, you can visit that link and follow the instructions. It'll give you the opportunity to obtain a consult and also be properly tested to get you prepared for what's to come in the next few weeks. Okay, so moving forward in the presentation, this is a novel virus, meaning never before has it been present in human population. It's been named COVID-19, also SARS-CoV-2. The propagation is very, very rapid. Already in 155 countries, there were no cases really before December. There's some speculation that around November 22nd was the first case. And this estimate is growing because of widespread testing. We really do not know how many people are actually infected and continue to propagate the virus. Today, from Johns Hopkins University, we are over 240,000 cases globally, with already more than 10,000 deaths. Here is a very critical piece of information. If you're there, if you're taking notes, I want you to learn this. I want you to take this down. Look at this. March 1st, this is USA only. There were only 76 cases. Today, March 20th, there's 14,000 cases. We went from 76 to 14,000 in less than 20 days. That is a 180-fold increase in less than 20 days. At this current rate of exponential spread, that means that in 2 more weeks, we're going to have 225,000 cases. In 2 more weeks, it means that we're going to have 2 million cases. In 2 more weeks after that, if it continues to compound, it could be 650 million people, meaning every single person in the US, unless we become very aggressive with our mitigation strategies. Make no mistake, the cost of underreacting is going to be far greater than the cost of overreacting. We're already playing catch up to this thing. According to the Department of Human Health Services, a moderate case scenario would be 38 million people needing medical care because they've become infected and they're presenting symptoms, and they're presenting the last stage symptom, which is difficulty breathing. 1 million may require hospitalization. In a moderate case scenario, 200,000 needing intensive care units. If this escalates to a severe case scenario, it could mean 2.9 million people requiring intensive care, and we only have 64,000 beds in intensive care in our hospital systems as a country. So can you begin to see why this is a really, really big problem? The next few weeks, things are about to get worse. It seems that when the virus hits and begins to propagate like it is right now, there is this huge 2-week curve of people just rushing into the medical system. And this is what they've been talking about, flattening the curve and flattening the curve. We are about 10 to 12 days behind Italy in this progression. And so right now we are about to enter where Italy was 10 days ago, when a lot of this really started picking up for them. The death estimate is saying that about 80% of the people that get the infection will just have mild or no symptoms. And about out of those 80%, 96 to 99% of them will recover from the infection. However, up to 1.5 million people in the US will die because of this rapid spread, and because there's no immunity. None of us have immunity to this virus, so we are all susceptible. Those at highest risk are those with a pre-existing chronic disease. We talked about diabetes and high blood pressure. Those over 70 years old. So this is your grandma, this is my grandma, this is our parents, our grandparents. So even if you're young, think about the fact that if you contract the virus and you are asymptomatic, you're out and about, you are increasing the risk of really killing or affecting the people that you know. Patient death rates. So chronic disease, if you're diabetic, if you have cancer, if you will have lung disease, autoimmune disease, if you're a smoker. This is one of the reasons why in that region of China it was so mortal too, because most of the older men are all lifelong smokers. If you're a vapor, listen to me. Linda, listen. If you're a vapor, it's very important that you discontinue vaping, because you might still have a chance over the course of the next few weeks. We can skip a little bit of the history. A lot of you have heard different theories. A lot of people out there are believing that this might be a weaponized virus. Truth is, we really don't know. Most of the key infectious disease specialists are saying it originated from a bat that bit one of these animals called pangolin. These animals are actually eaten in China for food. Someone ate it, became patient number 1, became infected, and because the virus is so rapidly spreading through respiratory droplets, it's now gone everywhere. Key point, nobody is immune to it. It's spreading primarily through droplets. It can live on certain surfaces up to 72 hours, and people that have the infection can transmit the live virus between 2 days to 14 days of having incubated it. However, if they die and they succumb to the virus, the cadaver might still be contagious as it decomposes. Symptoms, here's what to look for, and I'll show you the studies on this. Almost everybody that contracts it will first present with a fever. The first few days, there's really nothing there, but a fever that starts climbing above 99 degrees is when we begin to become concerned, followed by a dry cough, and then eventually tiredness, malaise. Fever, cough, fatigue, and dyspnea, which is difficulty breathing, is the sequence of symptoms that these patients are showing. A lot of asymptomatic patients that might just have a little bit of a runny nose or a very mild dry cough can still continue propagating the virus. And it's estimated that for each person that has it, they can then transmit it to 5 to 10 people. Ultimately, lung inflammation is where everything seems to go south for these patients. The disease affects the lungs, leading to respiratory failure in many cases because there's this huge burst of inflammation, something called a cytokine storm that dries up the liquid, the surfactant inside of the lung that allows the airway to stay open. And so ultimately respiration ends up shutting down. And it's a pretty horrific way to die. My tidbit on testing, we all know that we really are behind on testing on the US. The more that we can test, ideally people that have had an exposure, a potential exposure, but at least people that are presenting symptoms, the more accurate we can know the rate of spread of the virus, the mortality, the morbidity of the virus. However, we're playing catch up. South Korea did this kind of right. They were able to develop a test early on. It's 98% accurate, and so they've been able to know exactly how the virus has progressed and how they've been able to stop it, not stop it, but at least slow it in the last few days. Let's see, a really important case study was these 3,500 people that were stuck in a cruise. 706 of them tested positive, even though everybody was tested. And from those 6 had died so far. So 0.85 is the mortality in healthy, ambulatory, non-chronically ill patients. That means that this thing is 10 times more fatal than your average flu, but possibly in very severe epidemics of flu, it can have a comparable fatality. There has been some confusion about this topic of masks, and it's really built some distrust in the population, especially to the government, because of course, respiratory masks can be protective from the individual spreading the virus, but also may reduce the risk of you contracting the virus. And in an effort to reduce the absence or the deficiency of masks, the Surgeon General and the CDC told people that they weren't really very protective. And what they were doing is they were just trying to have enough for the government. And so if, you know, it's okay to say that, but to tell people that this is not effective when in fact it absolutely is and can be, really has created some distrust in a lot of the information that has come from the health sources, governmental health sources. We've talked about the delayed response testing will increase. It'll begin to scale, but it's possible that by the time it does that, it's already, as we're seeing, been spreading at a very, very fast rate. Each state has different measures. Here in Colorado, you first have to call or email your healthcare provider first. We're trying to make this easy for our patients. Again, that link that you guys have will give you access to contact us if you needed that. And then you need to receive an order from your provider, then present at a testing site with your ID and an order from your provider in order to be tested. Here's the thing. Go to get tested. There's so far, I don't know if there's enough tests. We heard this morning that we're scaling testing, which is great, but go and get tested if you are presenting symptoms. Okay, this is really going to help us have a more accurate assessment of how things are going. I talked about these steps. Again, I don't want to alarm you if you are not chronically ill, if you're not one of the people at greatest risk. Over 80% of people that will contract the infection, and a large percentage of the population will contract the infection. So if you're listening to this, I want you to know chances are high that you will contract this infection either sooner or later. 80% will recover without needing any medical assistance, any care. It'll be mild, it'll pass, everything will be okay. But for those beyond the 20% that will need some type of care, we're going to go into a deeper dive right now. You've heard about the importance of flattening the curve. That is exactly what Italy failed to do. It's what China failed to do. And it is what we are trying to absolutely make sure that we don't fail to do here. The first 2 weeks of this viral infection are very, very severe. They can be very aggressive. And if it's very rapid, it overwhelms the medical system. People can't be taken care of and they begin to die off. China and South Korea had to create some very, very tight measures to stop the continued spread. And we would call them draconian measures. They closed off borders. They forced people into their homes. They passed really severe curfews. And I mean, in a way, these things work. These things work because sometimes people left to their own devices won't listen. But if you're out there and you're listening, don't make it come to that, right? Follow the recommendations over the next 2 weeks. We need to be very responsible over the next 2 weeks. From there, things will slow down a little bit as far as the spread. However, not for the risk and not for those that have the disease. We've talked about the ventilator shortage before. I'm not going to get into that. There's a lot of accelerated movement in that direction. Basic recommendations: social distancing, avoid handshakes. Here's a few alternatives for those of you that don't know what to do. You know, the really awkward hug or the wave, hand on the chest, good seeing you. But stop shaking hands. Keep a 6-foot radius from others. Suspend travel, both leisure and business. Now is the time. The next 2 weeks, remember, are very critical. Stay at home and work for home if you can. Wash your hands a lot. It's amazing when we open doors, we never even think about this stuff. When we open a refrigerator, when we press the elevator buttons, these are the places where the virus can live up to 72 hours. So when you wash, make sure you cover under your nails, your wrists, all the areas that are involved. Hand sanitizer, if you have it available, great. If not, make sure that you're washing frequently. And here's really where the main presentation, especially for those of you that are dealing with type 2 diabetes, becomes very specific to you. Again, you are the highest risk population based on chronic illness. And if you're above the age of 60, 65, that risk then skyrockets. If we dive deep, we know that diabetes can both increase your risk of getting this infection and also your risk of succumbing to the infection. Diabetes induces risk for many reasons. One of them, when there's high blood sugar, and we're going to talk about what that means because it's not what you've told. A lot of people think that high blood sugar is 120 or 140 or 150, 160. The risk actually begins way below that, way, way below that. When there's high blood sugar, sugar sticks to proteins and to cells, and it sticks to cells from the immune system. It's called advanced glycation, and it doesn't allow these cells to work properly, then allowing the infection to grab hold rapidly in the body. Okay, so that's number one problem. Number two problem is that fluctuations in blood sugar are immunosuppressive. So they can shut down the immune system, making it both easier for the infection to come into the body, to progress from the upper respiratory tract into the lower respiratory tract, the bronchial tree and the lungs. So it makes it easy for the disease to progress. And then it makes it very hard because understand that antibiotics, which would kill bacteria, don't work for viruses, right? So it's only through very aggressive combination therapy that a virus could maybe be altered in its course, but the best possible course is for our own immune system to be able to fight it off. If the immune system is suppressed, it's affected, then it loses the ability to do that. Infections drive inflammation. All of you that are diabetic and that are either my patients or are wanting to be patients or whatever it might be, know that when you have an infection in your body, whether it's a urinary tract infection, respiratory tract infection, skin infection, gastrointestinal tract infection, blood sugar begins to climb. And it becomes very difficult during an infection to actually control blood sugar. And so here is the reference for those of you that are following along. In addition, there's also research now saying that high blood sugar might create an environment that is very beneficial for viruses in the body. Some say that it's because of the acidity of the body that they can propagate very rapidly. Others because it accelerates cellular function. Whatever the case is, we know that viruses like to thrive in this type of environment. And one of the most common complications when this happens, especially in a hospital setting, is diabetic ketoacidosis. So in a hospital setting, when somebody's having respiratory issues, they can be having respiratory ketoacidosis, right? Or they can be having, respiratory acidosis. And on top of that, you add high blood sugar, diabetic ketoacidosis, which is life-threatening, both are. It becomes very likely that they can succumb, that they can die from this combination. You already heard me say, death rate, mortality rate for non-diabetic patients, 0.9%, not that severe. Death rate for diabetic patients, 7%. And this is being compared to the general population. If we had a study, which we don't yet, amongst diabetics, it would probably be even higher than that. So what I want to talk to you about is a new paradigm today, a new method, a new approach, a new vision on how to make sure that this is not you, that you're just not another statistic. Now, no one can guarantee that, but there are ways of significantly mitigating risk. And for that, we need to begin to change the way that we think about type 2 diabetes and type 2 diabetes treatment specifically. We know that most controlled diabetics have the same risk as non-controlled diabetics of having complications for infection. And that is because the idea of controlling diabetes is it's a terrible idea. It does not work. And I'll show you why in a moment. This is the A1C chart. This is the chart that your doctor and every doctor looks to determine complexity, severity, progression, and treatment of someone with type 2 or type 1 diabetes. In this case, I'm going to speak into type 2 specifically. Most people are told that if they're around 7 or somewhere below 7, they're good. They're good, right? Well, the problem is a 7.0 represents 168 blood sugar measurement, right? 168, 172. This is very, very high blood sugar, especially if it's A1C. You know that this is 90-day average. So it means that your blood sugar has been around 170 over the last 90 days. And you're being told that this is controlled. This has many implications. The first one is that over time, guess what? You're going to need more and more and more medication to be able to stay around that region because the core problem is continuing to worsen. Nothing is being done for the root of the problem. And so blood sugar becomes unpredictable. It continues to creep up regardless of people taking their drugs, trying to change their diet, trying to follow their doctor's advice. The reason is it's just like if you were trying to control a fire. If you're trying to control a fire, it's impossible to control a fire. A fire will propagate all by itself. Even if you're trying to control it, it's much better to work towards putting out the fire in its entirety. Hopefully that makes sense. And so what we know as far as risk begins to lower when people are having A1Cs of 5.6 or less, right? When people are at 99 or less in their blood sugar, and a lot of the research is saying 80 to 85 fasting blood sugar should be target, should be ideal. A lot of you are thinking like, how do you even begin to do that? We'll talk about that. But here is a very simple principle, a very simple idea. If you have the sugar of a non-diabetic, you do not experience the complications of a diabetic, right? And that concept is called reversal of type 2 diabetes. Type 2 diabetes is not curable, right? Once you have it, you kind of have it for life. You have to take care of yourself, but your blood sugar levels can be reversed back to a non-diabetic range. And it is not drug therapy. It is not standard treatment that can do this. So you heard me about talking about putting out the fire completely instead of trying to mitigate and control the fire. What we've learned is that there's many different reasons why blood sugar becomes elevated. People say, well, my blood sugar is high because I'm a diabetic or I have diabetes. No. We call you a diabetic, or we call it diabetes. We call you a diabetic because your blood sugar is high, but why is your blood sugar high? What used to work that no longer works properly, that is forcing your blood sugar to go high? It has a root cause. And surprise, surprise, we have learned that from patient to patient to patient, those root causes can be different and they can be unique. The secret, the success to being able to help somebody reverse their type 2 diabetes and normalize their blood sugar back into a non-diabetic range is, number one, testing them. Creating testing that can begin to expose and help us understand why this person is not regulating blood sugar properly. Secondly, creating a treatment plan that is 100% custom to that individual. Not the same treatment for everybody, right? Everybody gets that label, you're a diabetic, now you're going to start on metformin. When that doesn't work, then glipizide, glyburide, or glimepiride. When that doesn't work, then Victoza, Invokana, or Januvia. When that doesn't work, then the once a week injectables or eventually insulin. That's the same treatment everybody gets, but the problem is everybody that has diabetes for reasons and causes that are unique to them. So is this approach successful? Absolutely. This was a publication last year out of the the American Journal of the Medical Association, where they showed that customized, personalized medicine in a model through that we call functional medicine improves health outcomes for patients with chronic diseases like type 2 diabetes drastically in comparison to the standard model of care. So not everyone may be a candidate for this type of intervention. That is why we've laid out that link. Haven't received it. Let's see. Here it is. This link will allow you to book a consultation and ultimately have a conversation to see if you would be a candidate for this type of care. So common outcomes that we tend to see in patients that take this approach is an A1C reversing to less than 6.0. Do you understand how drastically that can reduce risk of infection and complication from infection? Many of these patients begin to walk away from prescription drugs and in some cases, even insulin. For many of them, their vitality and their energy begins to be restored. Many of them begin to lose weight without exercise as long as they're applying and they're motivated to stick to key lifestyle changes based on the results of their tests. Thank you so much, guys, for having joined me. I hope that the information has been powerful, informative, empowering. If you are still with me, let me just show you how that link looks like. So to help you navigate a little bit, so here it is, HTTP, it's consult.type2diabetesbook.com. When you land on that page, whether you're on your mobile or your computer, it'll look the same way. You have a little bit of information about the model. For those of you that do create a consultation with us, you'll be able to receive a copy of our published work from diabetic to non-diabetic. We will send to you at no charge. if you have any additional questions that I haven't answered, if you're watching the replay, there's a squeeze page here that will come to us and we'll be able to answer those for you. Here is the opportunity. If you click on that link, you'll be able to schedule the consultation, and there seems to be an issue with the link, which was checked before we went on. So for the time being, go ahead and I'll have it corrected for the replay. For the time being, utilize the squeeze page. We will be able to get that for you right away. Thank you so much for joining me during this presentation. Stay safe. I hope it was informative. Send me an email. Let me know if you liked the presentation. I'm hoping to do a few more down the road. I saw someone raise a hand. Go ahead and send me a question, Mr. Charles. Okay, so no question coming through. All right, guys, have a great rest of your day. God bless you and stay safe out there.